You have better slides than this. So I like yours better. But this is an example of LACT or ACT or loose areolar connective tissue, the glue that holds us together. So this is loose. There's a wide open matrix. There are thicker fibers you really can't see. You can see the elastic fibers. Really nothing else. Earlier slides. Yeah. So a little better. So these are a little better. Let me go here. So there's your ugly slide. That's a better slide. That looks like what you see in your lab books. So when you put your slides on, it'll look more like this, because you can see the thick collagen fibers. You can see the medium-sized, the dark blue, and that's how they'll always be on your slides. That's a silver stain or Golgi stain. These elastic fibers of elastin protein. And I couldn't ask you reticular fibers on the lab exam. They're the tiniest fibers of collagen protein. That's a gorgeous slide too. So LACT or ACT, or loose areolar connective. Here you can see the thick collagen, the medium-sized elastic, and again, not a fair question, but there are tiny reticular fibers of collagen protein there. The things that look like purple dots, those are the nuclei of the fibroblasts that are now fibrocytes in the mature tissue. Fatty tissue, the adipose, really, it's not going to look that clear for yours probably. Those are adipocytes. If you can get it darker, so as you increase magnification, decrease light, that's not intuitive. Normally we increase light when we increase magnification, you know. This is different. You make it a little bit darker, you will see this is adipose tissue or adipose loose connective tissue. The cells are adipocytes that store energy, insulate us, and cushion us. That's a gorgeous slide. This shows you a blood vessel, and although I don't ask you, this is elastic tissue and smooth muscle, and then some DICT out here. This is her arterial structure. But what you got to know now, adipose loose connective tissue, adipocyte. Let's see. We've done that. We'll do others today. There are no muscle questions on lab exam 1. As surely as I'm saying that, 10% of the class will say that that is skeletal muscle. In this class of 31, how many people is that? 30, no, 3. In my class of 900, it's 30 people. In my class of this, and I'd say it'd be 90, but thank God it's only like 1/3%. Usually 3 of you will identify this as muscle. If you do, then we're going to talk afterward, okay? So don't do it. This is not muscle. Now, it could be any orientation. So as we flip it, it could be that way, all right? But you got to know this is dense regular connective tissue. What's the acronym for that? DRCT. You can call it DRCT. It's totally okay. That's what histologists do. So dense regular connective tissue. These are collagen fibers, and you can see the nuclei of the fibrocytes. They're elastic and reticular often too, but tendons and aponeuroses and ligaments are DRCT. So in your slides, they can be yellow or white, so don't memorize color. Alrighty, this one, if I use it, is pink, acid stain. Yours can be yellow or white based upon the amount of elastic fiber or elastin protein. Alright, that makes sense? That shouldn't be hard, but when you're adding all this stuff I know, it becomes intolerable. So yellow or white fibers, connective tissue, and this are examples of DRCT. And I don't think this is a good one. Oh yeah, it's okay. This is DICT. This is actually deep dermis. So if you look at slides 10 and or 11, and I'll do that in a minute, you can see see how it's not regular? So it's this whirly swirly appearance, like maggots. This is the deep dermis, also known confusingly as the reticular layer of the dermis. The tissue is DICT. So if I ask you of the 4 major tissue types, what is this? What's the answer? Connective. If I ask you specifically, what is it? DICT. Right, so and I really don't screw around with you like that, but you should know those terms. When you look at skin, and this is actually, I think, rat. When you, that's too bad. You see that This is gonna be the epidermis we'll talk about today. This is dermis. I won't ask you the LACT of the papillary layer of the dermis. I'll ask you the DICT of the deep dermis. So I would go on a skin slide where you see its skin, we'll know that in a bit, and I'll go deep like that. Deep, deep. Yes. We'll do this again in a bit. This is actually thick skin. So this is all epidermis we'll learn today. But I would go deep dermis. So deep here, this is DICT. Okay? So that's slide 10, 11. If you don't want to do that yet, after we do the first part here, then I'll show you a skin model and we'll work on the 2 skin slides. So then we'll go over all of these layers that you have to know. I'm doing it today on purpose so that come Monday we'll just do bone and cartilage. It's really 2 bone slides, just different orientation, and 3 cartilage slides. That's it for Monday. And then you've got time to catch up on whatever you need to catch up on. So that was slide 6, 7, adipose, yeah, then 8, 9, 10, 11. So that's it for now.